Hey everyone, it's Casey here. Just give me 1 second. I'm getting my screen set up and then we'll get started. And we're doing the Doctor Portal tonight. So we'll talk about the scribe, a few other hints, tips, tricks. Any issues, let me know, like any troubleshooting or questions. We'll get to that as well. Just bear with me for 1 second. I am running a little bit later than I had meant to because I wanted to show everyone something cool. I did want to show everyone something cool. So give me 1 second and we'll set it up. So, okay, I think we've got it here. Okay, excellent. Let me share my screen and we will, where am I? Where am I? Here we are, and we'll crack on. Any questions, feel free to ask them in the chat or in, I think there's a Q&A section, so chat Q&A. There is a recording of this that will go around, so we put it up on YouTube channel, so any issues, let us know there. Or if you have to leave or whatever, we'll put it up there. And what else was I going to say? I think that was about it. So let me share my screen and we'll get started. Hopefully you can all see that. Hopefully you can all see that. So I wanted to show you something that we're working on, which I believe is actually out in the wild. So I don't think we actually announced it. I think we just pushed it. So two new things that we've got is the mymedicare check. So essentially it'll check a patient and check that they are registered for mymedicare. So you can see here, this is a patient, this is me, and it says not registered anywhere. And you can click to send an SMS. So previously it probably just said not registered. Or if they were registered, it would have a green tick. So this is the waiting room, by the way. So the waiting room is when you have a BP integration or an EMR integration. We are working on MD, ZMed, MediRecord, ZMed, which is probably the next one off the ranks, but we're working on those other three. So the waiting room essentially pulls all your patients that are in your appointment book for best practice, and it'll show a couple of different things. It'll show their billing opportunities. So there's a test patient who's eligible for a health assessment just based on age, and a few other things. There's me due for some over 30 now, so heart health assessment, I guess, something like that. All your patients, so to show if they're due for care plans, health assessments, medication reviews, blah, 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 and based on billing history. So if someone's had a care plan, a month ago, then it'll show you that they're due for a care plan review in like 2 months. Here's a fun fact. If a patient has had a 965, you can do a 967 anytime after that. It doesn't have to be 3 months. We think 3 months because it's always been 3 months. But when you do a new care plan, it's actually any time. So you can do it like 1 month after a 965. You can do a 967. 967s are 3 months apart. So I got that confirmed by ARCS MBS. So that's a weird one, hey? Anyway, so the waiting room shows you all of those things. It will also show you a pre-consult. So pre-consult is a text that is sent out automatically. So you can see here, click to send pre-consult SMS. You don't need to click it. 24 hours before the appointment, the patient will get a text. If the patient booked in like 2 minutes, they're a walk-in, right? It probably wouldn't have sent. So you can click there and just send it manually. So if you have like a walk-in clinic or your books aren't full 24 hours and a patient books in, you can click it. Or you can put something like a QR code. So if you click this here, this is the link. So let me show you what it looks like, the pre-consult. So the pre-consult looks like this, and it's just like a chat bot. We have added, let me show you the new things that we've added into the chatbot. You can customize the chatbot to show all sorts of, let me move this one over here, to show all sorts of different things. So the chatbot is customizable. We're adding more things into it because we think the chatbot's actually going to become pretty valuable. What we've got it working as at the moment as it'll essentially ask general questions. So general questions about, so one, it'll say, what are you coming in with? In a nice way. Not what are you coming in with? What are you coming in with? Coming in for a script and, I've got a sore toe, something like that. And then it'll ask you some general questions. So, are you happy with your medications? Are you having any troubles? Essentially, this is prompting the patient for like, do you want a medication review? It asks about any chronic diseases that I mentioned. Do you want a care plan? It asks about mental health questions. It asks about if there's any issues like with workers' compensation. Also asks about DBA and CBC program. So I had a patient that was on Gold Card but did not have a CBC billing, and so it prompted the patient. The patient said they were happy to get it, and it came up in the waiting room because in the waiting room here, it'll have the pre-consult as like a text message, and it'll have a few other uh, what are these called again? Chips. So instead of saying 699, well, it'll still say 699, but underneath it'll have like a green chip that'll say, DVA, CVC, because they've talked about that. But then it also asks preventative care questions. Now, we don't have yet the ability to look at clinical information from a patient from best practice, but we are doing our My Health Record integration. And the idea behind that is that we will ask specific questions based on that patient's history. So it'll be like, we can see that you are due for your shingles vaccine, things like that. We're still working out the finer details of that. That's still coming, and exactly how it would work, and a few other things like consent. So that's an ideal situation where we'll be able to prompt the patient and say, you need these things based on your history, and you as a GP can look at it and go, yep, these are the things you need. So, bear with us. But currently, the preventative health questions, we just ask them in general. So if a patient books in and they are a female and they are between these ages, we will say, have you had your mammogram? And they may have had it 2 days ago. We don't know. We just ask the question. We say pap smear. I know it's CST. We just put pap smear. Maybe I should change that. So, and it'll ask any females between those ages and so on and so forth. So I feel like that is useful. The vaccination review is like based on age as well, but it's more general. So, it's pretty general. Obviously, we don't have the clinical information. It's pretty general. So I think they're useful. One of the things that we get is that one of the complaints we've got, and it's a fair complaint, is that the pre-consult's like too wordy. And you can see that if it asks every single one of these questions, it's absolutely going to be wordy. So we're modifying it a little bit more, adding in some more customization. So it's a work in progress. It's going to get better and better. So bear with us. So the pre-consult lives there. Now, your patient is booked in. You can see that they're coming in for their, script for their metformin, right? They probably have a chronic disease if they're on metformin, whether that's PCOS or diabetes or something like that, right? Like probably a chronic disease of some sort. So they're probably due for a care plan. So you'd have your care plan item number. You can see that they're registered or not registered for mymedicare. If you click on this, it will send the patient an SMS. So that's now going to go to my phone because I think and now I've got a message on my phone. And essentially the message says, I don't know if I can show anyone here what it says. No, I can't. Anyway, essentially the message just says, you're not registered for My Medicare. Your doctor, so it'll specifically say your doctor has asked you to register for My Medicare. So ideally you would talk to your patient about it. So you'd say, hey, I can see here you're not registered for My Medicare. My Medicare is uh, we're all still trying to figure out what My Medicare is, right? Like it's this program that will link the patient to the clinic and allow you to be billed like care plans, longer telehealth appointments, longer video health appointments, so on and so forth. So there's a few things. There's a few things there, that are useful, and that are useful. Anyway, so then they'll get a text. The text will have the My Medicare question. So let me show you what that looks like. My Medicare PDF. This is the registration form. So essentially, it's this form, but digital. It'll have the information pre-filled out. So, first name, second name, date of birth, blah, 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 because we already know that information. It'll have the practice details filled out. We already know that information. It'll have your name as preferred GP filled out. We already have that information. So all they need to do is tick a few things like so. Of course, they should read it and be happy with it. They understand what they're signing, blah, blah, blah. And then their name is filled out, and then they just sign digitally and then put in the date. Now, the other information they can fill out, so you may be aware this is information that is optional. It's useful for statistics and things like that. So that information is there. Again, it is optional. We only pre-fill the things that are mandatory, if that makes sense. So then that's filled out. And then let me show you here in My Medicare, where you can and should sign up with your organization ID, your site ID, your Proto registration, your B2B. We do have a video on this, but this walks you through. This is how the My Medicare check works. You can see how it's all registered here. You can put in an email address. So that email address at the moment could be like your practice manager's email or your reception or admin email. I've got a test email here because we're working on some other cool things, but you could just have it as an email. They will complete the form. It'll send to the email, and then your practice manager or your receptionist or your admin person could register the patient in Proto. So they log on to Proto, go to My Medicare within your entity, type in the patient's details, blah, blah, blah. Manual process, right? What we're working on, not quite there yet, is our document sorter, which is our automated way of putting incoming documentation into best practice. We have a Services Australia integration, which will upload it directly into My Medicare and register it straight away. So it doesn't rely on people logging on, registering, blah, blah, blah. It just does it straight away. So it's a very, very useful feature. It's not currently working. The reason why it's not working is we're just waiting on Services Australia to release some updates and things like that to work. So I was going somewhere with this. So you can just put in your practice manager's email or send them the email. I think that's probably the easiest thing to do at the moment. So back to our waiting room. So you can send a text, you can send the pre-consult. This little one here is the pre-consultation questionnaire. So in the questionnaire, we do ask consent for using the AI scribe. I think that's pretty useful because that saves you asking for it. So you have a green little tick there. The other thing you can do in here is you can refresh the My Medicare status, so it'll run the check again. And then the next thing that will be added in, which I think we did talk about last time, was the assignment of benefits. So when you register someone for My Medicare and send them the My Medicare SMS, it'll also send them another digital form to sign up for the assignment of benefits, specifically the enduring assignment of benefit. So if you have regular patients, we all have regular patients. Those patients absolutely should be on couple different things. Like regular patients probably need to be on care plans because that's why they're seeing you regularly for some sort of chronic condition. They should definitely be registered for My Medicare, and they should definitely have an enduring assignment of benefit, which will save all the bother of assigning the benefit, blah blah blah, all of that sort of mumbo jumbo. So they're the three things that we think are useful, and that's what we're trying to do within this waiting room to make it more useful. Now, the other thing that I want to chat about, so let me talk about it quickly first, is PBS authorities. So specifically, some of the errors that you might be getting. So there's a couple different errors, so problems, errors. Actually, let me go into my waiting room and we will pre-fill some of this information. So if you click on your patient, it should pre-fill their information like so. So I wanted to show you some of the errors that you might get. So one, you do need to put in your prescriber number. If you don't put in your prescriber number, I mean, clearly you need to put it in to prescribe anything. But if you search for a medication first, so let's do good old Nexium 40. They come with 30 in 1. That's what you do the authority for. So 30 in 1. I'm going to star that and add it to favorites. So that means if I need to look for it again, it will be in my favorite. But if you go to do the restriction questions and you haven't, are there no more restriction questions for this one? I thought there was. That can't be right. But if you have questions, they don't populate until you finish this. So 2976158. Actually, that might be the fix for it. And then you can enter your authority. Let's see. Yeah. So you need to fill out the reason why we've got these steps. So step 1, this will have a step 2, but it's ticked because everything's filled out. This will have a step 1, 2, 3, but it's already filled out. And then this is step 4, so it's blank, so it hasn't been filled out. So I think that we've actually fixed that. So previously you'd go to it generate the questions, are you on, like, do you need a PPI? Is it inadequate control with standard dose? Those questions would generate, but then error out because you hadn't filled out the prescriber number and the authority script number. So it looks like we've fixed that and saying that these things do not generate until you fill those other things out. So that's good. But that was a common error. Now, another error, which I'll show people, is with medications that can be prescribed by multiple different prescribers. So the most common that I see is tramadol, where there are, I think, like nurse and midwifery prescribers, and I think even like palliative care physician, because used in palliation, I suppose, as well, for some of the injections and things like that. So you can see here, and look, this is not the best example of a tool that is completely schmick and slick. Tramadol is the worst for this. There are like 10 different types of tramadol, and you can see how I can scroll down the screen. So what you can do is you can like search for the specific dose, and that will narrow it down. We have added in, oops, sorry. We have added in the ability, may not be out quite yet, but the ability that you can hover over it and it'll pull out the full PBS criteria. Because if you looked at this, 8525Q, like what does that mean? That is a PBS code. So if you want to, 8525Q, you can actually search that one if you go onto PBS online. Wow, this looks different. 8525Q, and it should bring up like tramadol. Wow, I don't like the look of this anymore. This is completely different. Has anyone seen this before? Interesting. Oh my goodness. I haven't been on the PBS website in a long time. Anyway, it's a bad example. Let me go back to where I feel safe, to my safe space. This is better. This is a specific code that is relevant to the medication that you're prescribing. So tramadol can be prescribed by multiple different prescribers. So if you put in tramadol, the other one is Penadine Fort. If you go to tramadol and you sort of click on one of these random ones, even though, yes, 10 of tramadol, 50, like that's reasonable. What might happen is that it'll let you put in your information, your prescriber number, your authority number, everything into the restriction codes, and you go submit, and then the answer will go can't prescribe, wrong prescriber number for this medication. So specifically what it's meaning is that you are a GP and this is an authority code for someone who is a midwife or a nurse practitioner. Can nurses prescribe? It seems like everyone can prescribe these days, right? Like someone. So it's a wrong prescriber number for the specific code. Now, I appreciate that that's something that we've got to work on, because you can't exactly see very clearly what each different Penadine Fort thing is for. And there's, Penadine Fort 10, Penadine Fort 10, Penadine Fort 10. So the easiest way to get around these things is just to have your favorited medications. So if you do, you could have Vyvanse and you commonly do 40s, put in the 40s. And that will mean that when you select on the patient, you only need to put in the script number. Everything else is pretty much pre-filled. You've got your Vyvanse there, answer your questions, and then submit. A couple of things that we're going to do to improve this. So we're working on this so there's less error codes, to make it a bit more intuitive for selecting your medication. And then the other thing that we're doing, because of the My Health record integration, you'll be able to sync with the patient's medications. So let me show you what that looks like really quick while everyone's there. So this is our My Health record integration. Essentially, what it will do is you have the ability to see medications that have been prescribed and dispensed, and that will sync with your PBS authority. So it'll be like a much slicker process. You know exactly what needs to be prescribed and what the authority codes are, because we know exactly what the medication is based on that. So that's in the work as well. So that's PBS authority. There are a few of the error codes that you might get. Let me have a quick look at the questions and see if there are any around. We're doing pretty well for time. Got a few here. Excellent. Thank you very much. Is sending SMS included in the BP integration fees? No, it's all included. So we, just to explain sort of the way that we charge, we have like our base scribe, which you can still use PBS authorities. You can still use the pro to item check. That isn't reliant on best practice. You can still do the mymedicare check. You can pretty much do everything, but you just need to manually enter the patient's details. You can see here my details have been pre-filled because it's based on the integration. So I can check here if I've had a care plan or whatever done before, which is perfectly fine. With the BP integration, we pre-fill it. Now, the only thing that you need, the thing that the BP integration gets, which we do charge extra for, so it's like $99 a month for the scribe as a base rate, but we do deals for like say clinics and things like that. So we'll do like volume discounts. And then the BP integration we charge separately is $15 a month. The reason why we do that is we get charged from BP, so it's like a revenue fee that we've got to pay. And it includes the access fee to BP, which we get charged, and SMSs. So that's a cost. We just bundle it all in one as that extra fee. So that's sort of what we do. And that will include your SMSs for like your MyMedicare signing up, your Enduring Assignment of Benefits signing up, your pre-consult sign up. And then it also gives you access to waiting rooms. So all your patients with all their billing opportunities, your estimated total time, when you're going to finish on time, MBS opportunities, dashboards. So your dashboards is like your analytics. So if you go into here in the dashboards, it'll show you what you've billed, etc. And then the other thing I'll quickly show you, CPD. So CPD is coming. This is a tracker that you should be able to see. We are applying to the AMC to turn it into a CPD home, so that you'll be able to run all your CPD through here. So they're the things that are sort of automated with the BP. So pre-filling out details in Proto MyMedicare PBS, the waiting room, the dashboards with the analytics, the pre-consult MyMedicare assignment of benefit. Cool. Let me see if there are any other questions there that I missed. That one's good. That one's good. That was good. Yeah, so yeah, give the PBS a try. It should be like we're pushing out fixes. So you've probably noticed that even in the last year, we've got a ton of different features that have come out. Lots of different things. What we've done now is we've changed from a sprint. So we used to do a sprint cycle. So that's usually every 6 weeks we would do a sprint. We've now changed it to every just like literally just whenever a new update comes out, we just push it through. So it's a ongoing cycle. I don't know if that's the right word to say. So it's just a cycle thing. So every time something new comes out, we just push it through. So they're the new things. The My Health Record is coming. We've been approved for security for that. So hoping to get that out in the next sort of 2 to 6 weeks, end of September at the latest. Another question there. Cool. Another question. Well, someone was coming in too. No, okay, that's fine. Someone's going to ask a question. Where is AOB? Not there yet. It's coming. So there'll be another text that will essentially, not text, sorry. There will be another thing in the waiting room and it will have AOB. And then it will send out to the patient with the My Medicare. And it'll show you if they're registered to My Medicare or not. And then if they are registered, as in have an enduring assignment of benefits on. Was there a question there from Benestry? CBD tracker. Okay, yes, good question. So the CPD tracker at the moment is just a tracker. So it is not that useful. I'll be happy to say that. So what that means is that you can, let me show you. You can just track stuff here. So you can add an activity. You talked about diabetes with your, colleague for like 1 hour. You can just track that. That's fine. The other thing you can do is you can use our research function. So this research function is like clinical decision support. I think I'm still allowed to say that with the TGA. So how to treat diabetes. And essentially it'll give you like sources for treating and initiating pharmacotherapy, blah, 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 all of this other sort of stuff, right? So if you go, oh, that's interesting, I would like to read, Australian Institute of Health, AIHW.gov report on diabetes, and, I want to read a bit more about this or whatever. When you go back to here, it'll track that you've read it for like however much time. We can't actually track how much you've been on a website because we don't do that. We don't track what you're doing on the website. So you can say, oh yeah, I spent 10 minutes reading that. I'm going to add it to CPD. So now it's been added to your CPD. Again, it is just a tracker at the moment, but we're going to turn it into a CPD home, meaning that it will have all of your activities that you've done and it will upload it directly to the Australian Medical Council. So it'll keep an eye on everything. So you can do everything through the scribe. It'll be an extremely useful feature, extremely useful tool. It will just be bundled in with the scribe, so it doesn't cost anything. So it'll save a bit of money as well. And I think that'll be useful and cool. Let me show you. So you have your activity log. So we talked about, diabetes. We read it for, 0.17 of an hour because it's like, 10 minutes, whatever. And then we have all of our recommended resources, which we just grab using AI from the internet, and pull and post it here. So you can listen to some podcasts or, read some cool things. Still a little bit of work that needs to go on, so it's getting there. But that'll be cool. That'll be really cool, I think, the CPD home. Any other questions? Oh yeah, so a question here. I haven't used the research evidence feature much yet. Do you derive it from ETG? So it derives from ETG, AMH, MIMS. Does it derive from health pathways? I think some information. I think a whole lot of information. So it is an AI like assisted search. So it grabs a whole heap of like resources. We've fine-tuned it with Australian-based resources. So DermNet, STI guidelines, like pretty much anything you do to pass GP exams. DermNet, STI guidelines, Royal Children's Hospital, Queensland Health Guidelines, um, Ortho Bullets, which is a good one. All those sort of resources that you use in GP, we jammed it in there. So I think it's pretty good. I use it quite a bit. Great for like quick, what's the equivalent PEDS dose of this, blah, blah, blah. Great for anything. You can see here that it has different levels of thinking. So you have standard thinking, quick thinking, in depth for like a review. Um, and so I think it's good. You can look at, previous things that you've looked at. You can start a new search. You can ask follow-up questions about, okay, specifically, what about metformin do I need to do? Yada yada. And then add anything into your CPD tracker, but soon to be CPD home, which is useful. Cool. I think I had another question there. No, no. Yeah, okay. My dashboard showing my Medicare registration status, but not able to send SMS. Okay, so maybe it isn't quite out yet. If I've said it's out, but it doesn't say send SMS, that might be it's coming soon. So if it doesn't say it, that's okay. We're planning to release that SMS feature with the assignment of benefit together because I think it makes sense to do those two things together, right? Like you sign up for my Medicare, sign up for your enduring assignment benefit, together. Cool. Okay, so 7:59. I think we've done really well. Another question here. Okay, any release of MBSPro app for iOS, Android? Yep, we've got an app in the works. We've got it testing. We've got a few people using it, and that is useful. Otherwise, you can use this on a browser on your phone, and it's like appified, if that makes sense. So it works really well. But yes, we do have an app coming. How do we send info to patients' email? So let's say you have finished a consult, right? Let me get rid of that. Let's say you have finished a consult. Okay, I've got no consult. So there will be, I'll do a test consult here, right? So if once you've finished a consult, once you've finished a test consult that we talk about type 2 diabetes, starting on metformin, and give an information sheet, right? So information sheets, let me just show you real quick where that is too. So the information sheets are in the research function, and you can go browse, and we have a whole heap of manual ones, or it will do an AI search. So the manual ones, for example, we have Jean Hale's menopause. So let me click on that, and it'll show you. This is like the menopause. Yeah, Jean Hale's is another one that we Gene Howe's a great website. So this is the menopause link. So you can click here and then type in the patient's email and then go send, and it'll send it to them. Same as when you do a care plan, you can generate a care plan or a note. So let's go finish. It'll give us our note about how we talked about sending information via email for menopause. It's working. Boom. And then you can share it. So you can email it to patient. So if you have the BP integration and their email is in there, that will be pre-filled, or you can just email it to, anyone. Obviously only email it to people that, you have consent to email it to, or, or need to have access or whatever, not just anyone. But that's how you can do that. And then anything else that you generate. So say you generate a referral. Oh, I should have talked about our PDFs. Let me talk about that real quick. So say you generate a referral to, say, the cardiologist. So we have put back in the brief and detailed referrals. I know that was missed. You generate a referral, and then you can, when it fills out, I'll show you this feature in the meantime. I'll show you our PDFs. So we've got a new PDF creator, which should be in there. What that means is that you can fill out PDFs and you can, so let's do work cover. Say, for example, it'll generate and fill out a work cover information sheet using the information that you have provided to the patient in the consult, as in what you've talked about. I don't think the referral is working because it wasn't long enough. So that's what happens when you have a short consult. Let's see what this work cover does. If you have a long consult, this should work, and it'll pre-fill. Yeah, so you can see it's talked about, commence metformin. The patient has type 2 diabetes. Obviously, the more information you give it, the better this will be. But it will fill all that out. You can download it, or you can print it and give it to the patient, and that is useful. Now, the other thing in here, which isn't quite here yet, I believe, no, it's not, is, so yeah, at the moment, print or download, clearly an email feature would be quite useful as well. We're adding the ability to email it to someone and or email it to your document sorter, which will put it back into your patient's chart so it's there automatically instead of having to scan it. But it's in the works. Everything's in the works. So yes, you can email using that feature down there. All right. Any other questions? I think we're going all right. Good. Okay. No other questions. Excellent. We'll pull up stumps there. It's all recorded. It'll go on our YouTube. We do this twice a month. So Doctor Portal tonight, Clinic Portal in about 2 weeks' time. We've got some really cool features coming out. My Health Record hopefully coming out September. That's what we're aiming for. Had that approval for security, so it's coming. But otherwise, I will stop sharing. Appreciate your time. Thanks everyone for coming. Hopefully that was useful, and we'll catch up next time. All right. Thanks everyone. Have a good night. Bye now.